नमस्कार, मेरा नाम डॉक्टर प्रीति रहेजा है। आई एम अ सीनियर कंसल्टेंट गायनेकोलॉजिस्ट विद पारस ब्लिस हॉस्पिटल। आज मैं एक बहुत ही कॉमन प्रॉब्लम PCOS के बारे में डिस्कस करूँगी आप लोगों से। अंडरस्टैंडिंग फर्स्ट व्हाट इज़ PCOS, व्हाट इज़ द फुल फॉर्म ऑफ PCOS? वेल, इट इज़ पॉलीसिस्टिक ओवेरियन सिंड्रोम. It is a common problem which affects almost 15 to 20% of females in their fertile age group. To understand a little about the word PCOS, P stands for poly and C stands for cystic. So basically ये एक problem है जिसमें ovaries में multiple cysts होती हैं. Usually girls हम स्टार्ट करेंगे कि लड़कियों को क्या प्रॉब्लम होती है, वो किस प्रॉब्लम से हमारे पास आते हैं. सो डिस्कसिंग द सिम्टम्स, मोस्ट ऑफ द टाइम गर्ल्स विल कंप्लेन दैट देयर पीरियड्स आर स्पेस्ड आउट. That means that the duration between each cycle is getting longer day by day. It could be more than 30 days and gradually becomes 40, 45 to even 60 and more than that also sometimes. Often along with that, the girls would complain that the periods become scanty. The flow gradually becomes lesser and lesser. And some would say that it would last only for a day or two. These are some of the menstrual symptoms which the girls would complain. Along with it, the girls would also complain of acne on the face. There could be increased weight gain. There is a sudden and a very high proportion of weight gain. Often girls complain that there is facial hair growth. All this happens because of hormonal imbalance. Understanding that what causes it, we really don't know कि क्या इसका रीज़न है, बट डेफिनेटली ये प्रॉब्लम हमारे जो फर्टाइल एज ग्रुप की गर्ल्स में हैं वो इंक्रीज़ कर रही है. अब आप अपने whosoever has these problems needs to consult a doctor. When you come to a doctor, the doctor will first take down a complete history and then accordingly a few hormonal tests which are blood tests और साथ में एक अल्ट्रासाउंड आपको एडवाइस किया जाता है. उसी के बेसिस पे on the basis of these three, the symptoms, the hormonal study and the ultrasound, the diagnosis of PCOD is made. Once the diagnosis is established, then it is very important to take the treatment. Why is it important to take the treatment? Because it is a hormonal imbalance. If not corrected, then it can increase and be associated with a few other problems, and later on in females can lead to infertility. What are the modalities of treatment which we adopt? Before starting the treatment, we always counsel the girls that it could be a long-term treatment, and so it requires a lot of patience, and we give a lot of reassurance to the patients. Along with that, it is very important for the girls to understand that since it can lead to infertility, so young girls who are not married, who are in their early 20s, we often advise them that they should plan their pregnancies at an early age. Why should they plan their pregnancies at an early age? Because PCOS is a cause of infertility, and secondly, the age factor also comes into play as the age advances. So it's very important for them to plan their pregnancy at an early age. Along with that, there are various modalities of medical treatment which are given. Most of the times patients respond, and if they take the correct treatment for the time of duration, if they have a good compliance, then the results with the medical treatment are very good. The main line of treatment is the oral contraceptive pills. When we prescribe oral contraceptive pills, we again give reassurance to the patient that this is actually the mode of treatment, because many a times oral contraceptive pills are just thought to be pills for preventing contraception. No, they very well correct the hormonal imbalance, which is the main cause of the which is the main cause of PCOS. When girls who are already married and they come to us, then our aim, and of course they would want to conceive now, our main aim, our line of treatment then changes, that we need to correct the hormonal imbalance and simultaneously make them conceive. So there are different other medicines which are added to the treatment so that conception